Hey, I'm Alex with GME Supply, and today we're talking about first aid kits. In this video, we'll explain the differences between Class A first aid kits and Class B first aid kits, as well as the differences between a first aid kit and a trauma kit. ANSI spells out the minimum requirements for the contents of a first aid kit in their Z308.1 standard. If you need more info on that standard, including how to decide between a Class A kit and a Class B kit, as well as first aid kit subtypes, watch the link at the end of this video. Under ANSI Z308.1, a Class A first aid kit must contain all of the following items: 2 5x9-inch trauma pads, 1 4x5-inch cold pack, 1 fluid ounce total of eye and skin wash, 2 3x3-inch sterile pads, 2 pairs of medical exam gloves, 2.5 yards of adhesive tape, 1 4x4-inch gel-soaked burn bandage, 1 40x40x56-inch triangular bandage, 1 pair of scissors or trauma shears, 2 eye coverings with means of attachment, 4 yards of 2-inch roller bandage, 16 1x3-inch adhesive bandages, 1 breathing barrier, 10 packets of antiseptic, 6 packets of hand sanitizer, 10 packets of antibiotic application, and 10 packets of burn treatment oil, as well as a first aid guide. Class B kits must include all of the previous items, but in 2 to 5 times the quantity, as well as a few extra items to address more serious injuries. Those include 4 yards of 4-inch roller bandage, 1 4x24-inch splint, and 1 1-inch width tourniquet. ANSI doesn't require any medication. However, a lot of kits do include things like aspirin, ibuprofen, or antacids just for additional treatment. For that list of minimum required contents, you can click right there to be directed to our knowledge base or check the description of this video. One thing to note, unfortunately, some materials in first aid kits do have expiration dates, so it's important to routinely check your kits for expired materials and replace them as needed. We also recommend that you refill items that are more than 60% depleted. While Class A and Class B kits do cover minor differences in the severity of injuries, trauma kits cover a whole new realm of injuries. Trauma kits are used for potentially life-threatening injuries, such as a very large wound. These kits do typically contain similar items to a standard first aid kit, with the additional items for those more serious injuries. This may include more or larger dressings or bandages, as well as tools to measure vitals, such as a stethoscope or a sphygmomanometer, which is also known as a blood pressure cuff. For certain industries, it is a good idea to have a trauma kit. However, the average worker may not have the correct training to properly use it, so you'll typically only see one where there is a trained professional on site. By now you're probably wondering, is it better to build my own kit or buy a pre-made one? Well, the answer is both. While it is a totally viable option to build your own kit with the specific things that you need for your specific task, it still has to meet the minimum requirements for ANSI Z308.1 compliance. Luckily, First Aid Only makes kits in every size and every class that are a cost-effective way to make sure you're in compliance, so you don't have to go out to the hassle of finding each individual item. Then, after purchasing that standard kit, it is always a good idea to think about what extra risks you may be exposed to in your work environment and further customize that kit to suit your needs. For a complete selection of first aid kits and refills, visit gmesupply.com. You can click on that video to learn more about the ANSI Z308.1 standard. Subscribe to our YouTube channel to see our latest videos, and follow us on Instagram, Twitter, and Facebook.